Good morning, afternoon, evening, everyone joining us in this virtual panel. Welcome to the talk, Advancing Disability Rights Around the World. My name is Dr. Jen Rinaldi. I use the pronouns she, her, and hers. For an audio description, I am a white woman with glasses and a short brown pixie cut. I'm wearing my netted red top today with my black camisole. My background is white with some plants and a bookcase. I'm an associate professor in the Faculty of Social Science and Humanities at Ontario Tech University. And I am an event co-organizer and I'll be your moderator today. I'd like to begin by acknowledging that the host for this talk is the University Ontario Tech. And Ontario Tech University acknowledges the lands and people of the Mississaugas of Scugog Island First Nation. And we are thankful to be welcome on these lands in friendship. The lands are situated on and covered by the Williams Treaties and are the traditional territory of the Mississaugas. That's a branch of the Greater Anishinaabeg Nation. Which includes Algonquin, Ojibwe, Odawa, and Potawatomi peoples. We start here because we must be mindful that the disability service providers who will speak today, many of whom work in impoverished countries, all contend with colonial and imperialist histories. I'd like to turn over this talk to our university's Indigenous consultant, who has agreed to open the event with ceremony to help ground us. Thank you, Jill Thompson.
Miigwech Jen. Anin, Bojo, Jill Indishnika, Skugog Minising Danjuma, Anishinaabe Kwe, Minogijigat. So I just said hello and welcome in the Anishinaabe language and said my name is Jill Thompson. I am a member of the Mississaugas of Scugog Island First Nation, and I'm the Indigenous Cultural Advisor at Ontario Tech University. And just wishing that you all have a good day. So welcome everyone. The ceremony that I'm about to do is called a smudging. Not sure if everyone is aware of the explanation of smudging or even if they've seen it before, but I'll just take a moment before I light the medicines to let you know a little bit about it. In this smudge for my people, not every Indigenous group does this ceremony. So it's not across the board that we all do it, but in Anishinaabe people do. And it involves 4 sacred medicines: sage, cedar, sweetgrass, and tobacco. And they're all natural. So not not tobacco from a cigarette or anything like that. It's all grown naturally and harvested. So what we do is we have a smudge bowl. This is what it looks like. It's an abalone shell. And we put the 4 sacred medicines, and you can also do them separately. You don't have to have all 4 in the mix. As today, I just have sage in the mix because sage gives off the nicest aroma. And so that's always my favorite one. And we have an abundance of sage on hand. We don't have a whole lot of tobacco on hand. So I thought I would just do sage today. But what I would do is light the medicines with a wooden match. I won't show the fire on the screen because that is the sacred part of the ceremony, the sacred fire. But once it's extinguished, I will hold up the bowl. You'll see the smoke rising. And the smoke is what we use to sort of wash over ourselves with that smoke. And it's basically to cleanse ourselves, to ground ourselves, to take any negative energy and sort of get rid of it, but bring in positive energy. So we ask Creator to please bring positive energy and to help us start things off in a good way. And so that's what I'll be doing. There's no really right and wrong way to smudge. Some people like to take their glasses off, or if they're wearing jewelry, they remove their jewelry, simply because these are not natural parts of our body, but they're for other reasons as well. But they'll smudge their eyes, they smudge their ears, they smudge their mouths, their hearts, and basically put it over their heads in a way. And then some people go up and down their bodies with the abalone shell. But again, all you really have to do is sort of wave the smoke towards yourself. And that is enough for you to smell the sage and for those endorphins to start working, and it creates a calming effect. So it helps to calm us and helps to ground us. So with that being said, I will light the smudge. Oh dear. I think my wooden matches are getting old, getting very brittle. So we weren't here for 2.5 years because of the pandemic. Please light. Oh, here we go. Just lighting the smudge now. Should only take a minute to get going. And what we do after, in case you don't know this, is once the smoke has, stopped smoking, once the medicine has stopped smoking, really, we don't extinguish it ourselves. We wait until it's completely out, and then we return it to Mother Earth, because that's who sustains us, and that's who gave us everything in the first place. So I'm just using an eagle feather, by the way, which is a sacred indigenous item. There's the smoke rising from the medicines. There it is, like I said. So if some of you want to, I will use the eagle feather and I will shift the smoke towards you. If you want to go like this and receive it virtually, feel free. Otherwise, I'll just show you what is typically done. So again, I'm removing my glasses. I just basically ran it over, smudge the smoke, put it towards my eyes, towards my ears. And the reason why we do this is so we can see clearly, we can hear clearly, we can speak clearly and speak in a good way and towards our heart, so that we do everything in a good, kind way. So that's basically how we do a smudge. And I hope that you all have a really enlightening session and have a good day together. Miigwech for having me, Jen.
Miigwech.
Bamapi, which means I will see you later. There is no word for goodbye in Anishinaabe.
Thank you so much, Jill. Miigwech.
Miigwech.
Welcome, everybody. My deepest gratitude to Jill for helping ground us. So some housekeeping and some introductions. This event, Advancing Disability Rights Around the World, is a part 1 of a 4-part virtual speaker series called Advocates Assembly, disability research from the ground up. The series is hosted by the Institute for Disability and Rehabilitation Research. That institute was established in partnership with Ontario Tech University and the Canadian Memorial Chiropractic College. The Institute is committed to conducting applied research that is relevant to policymakers involved in disability and rehabilitation. In this vein, this series will connect disability and rehabilitation researchers to community-based research principles and goals. So across this series then, disability justice activists and disability-centered service providers will speak to the lived experiences in community conditions and the most pressing needs of disability populations. And that's all done in an effort to frame the future of disability and rehabilitation research. I'll just note that our next event, Imagining Accessible Worlds, will take place Wednesday, October 5th. If you're interested, registration did just open today. I'll put the link in the chat now, and I'll do so at the end of the event as well. This project was funded with a Social Science and Humanities Research Council Connection Grant. We are so grateful to SLIAO for providing ASL interpretation services today, and Canadian Hearing Services for providing live captioning, which is, I think, available. If not on your screens now, you can select a button at the bottom of your screen. Hopefully you will be patient with us as we work out the first kinks in our first event around spotlighting and featuring our ASL interpreter. But for best viewing advantages in the Zoom meeting room, I would suggest using the gallery screen because we might have some trouble pivoting spotlights as we start the talk. So we will at least always have an ASL interpreter featured on your screen. And then the rest of us will probably be along your top of the screen. I want to also extend my gratitude to professional disabled artist Ann Abbott, who created original commissioned artwork for all of our promotional materials. That is that gorgeous painted landscape in the poster and on the event page you saw when you were registering. We've linked Anne on our registration page. So if you're interested in purchasing her art, you can find her that way. I'd like to also note that this presentation is being recorded and will be available on our Institute website. That's the IDRR website following today. Not immediately, but eventually. The chat window is open for engagement. We ask that audience members turn off their cameras and microphones for the duration of the talk. And then during the question and answer period, you can raise your hand. You're welcome to turn on your camera and your microphone to speak directly. You can also pose questions in the chat window, which we'll do our best to collect and read to speakers if there's time for a Q&A. All right, that's it for me. If the speakers are ready, I'm so grateful to them all for joining us from distant lands to share their collective expertise. So rather than my going through the introductions myself and the credentials are myriad, I'll just ask each speaker to introduce yourself, your organization and your institutional affiliation, and your contributions to disability and rehabilitation research. You're also welcome to provide your pronouns and an audio description of your space and your person. You're free to take whichever turns you like. I can offer someone to start, or you can volunteer.
Okay, I can volunteer myself. Can you, everyone hear me?
I can hear you. I might not see you on my screen. Yeah, I see you. Go for it.
Okay, perfect. Perfect. Good afternoon, good evening, good morning, to everyone. For audio description, my background is the Cape Coast slave dungeon. I am wearing clear glasses. I have locks, which I have currently put in a ponytail, and I'm wearing a dangling cowrie earrings. And my pronouns is she, her. Again, hello everyone, and thank you, Jen and the crew for including me in this Insight Shirk grant opportunity to share and contribute to the conversations of disability and rehabilitation from a global perspective. As already mentioned, I am Dr. Evelyn Kissy, a tri-citizen, I call myself, scholar situated at the University of Ghana in the College of Education, teaching courses under the umbrella of disability history, theory, inclusion, and community development. I am an adjunct assistant professor, lecturer, as it is known here in Ghana, at the only graduate program in Canada, Critical Disability Studies at York University. I'm also a graduate from that school. My background in the academy has been solely on disrupting the discourses of disability using an anti-colonial Sankofa and Pan-African perspective. This means that I look at disability from a disablement perspective in order to understand what African disability justice should look like. My work thus far has been central on reawakening the archives to Sankofa disability and disablement, and to retell the story, or the history, I should say, of disability through the excavation of archival documents. One of my passion working with the archive was to better understand how disability, disablement, and the body was situated within pre-colonial and colonial documents, and how it relates to the narratives of what several folks have seen as the dehumanization of disabled folks across the globe today. I have worked within communities of Black educators in Canada to rethink how we support and decolonize curriculum, particularly on how it has raised African Black children and families for centuries. I was in a 2-year project that looked at the impact of COVID-19 on African Black folks globally, while also understanding the disabling structures of vaccine equity. But currently, I'm working on a disability in education and sustainability conference here at the University of Ghana in the hopes of gaining momentum from funders for a disability in education institute and a critical disability studies program. We are looking for partners, collaborators, and most importantly, funders of both the conference and institutes. I will end there for now, and I look forward to this amazing space to have a more open conversation. Thank you.
What an excellent way to start, Evelyn. Thank you so much. Anyone want to go next?
I can go if you wish.
Claude, the floor is
So
yours.
my name is Claude Telzef. I'm the current president of the International Society for Prosthetic and Orthotic. While I come from Canada, I've started my professional life in Canada, but I left in 1997 to start to work overseas in the humanitarian sector. I worked for the International Committee of the Red Cross for more than 25 years, in which I have led the physical rehabilitation program for in the last 14 years in my life with the ICRC, and working in different contexts, different countries, and try to find, well, I would say, appropriate solution to overcome common challenge that the country face, but also a specific challenge according to the context where we were providing support, because the way we were working and still working, my colleagues from the ICRC, it's we do not we were not the one providing the services. We work with local partners to develop the capacity to be able to take over the responsibility of providing services and looking at different issue regarding both rehabilitation and assistive technology at the same time. And of course, people with disability are often one of the, I would say, main customers of such services, but not only one. There is also the aging population. So it's important that people keep aware or awake of the society in which they are living to be able to find the best solution. So I have different type of background, and apart, I was lucky enough to be able to take some pre-retirement in 2019 from ICRC. Now, apart from taking care of my garden, I'm also involved in different kind of I would say voluntary work with the ISPO as the president, but also with WHO, where I'm a member of the steering committee of the new or incoming World Rehabilitation Alliance, working with the people with assistive technology, with the rehabilitation. So I'm involved in different kind of things, and not only, and I will say that most of my entire professional life was to work with in lower income setting, okay, and trying to understand and the importance when you do this. Well, I will never be people from Ghana, but I could try to understand what are the challenge of Ghana, which is a not today kind of thing, okay? So I've learned to be flexible and to be able to listening what's happening around. It's a short resume, okay, but and I look forward for this, what looked like a good discussion, or interesting one.
Wonderful. Thank you so much. I have Valentina and David next on my screen.
I can go ahead.
Valentina, the floor is yours.
Good morning, afternoon, evening, everyone, depending on your time zones. My name is Valentina Pomatto, and I'm today wearing glasses. I have an oval face. I'm a white woman. I have a medium length brown hair, and I'm now in my office. It's almost evening, so the light is going down. And behind me, there's a white wall with a nice poster from HI, the organization I work for, Humanity and Inclusion. So maybe something more about my background, my work. I'm currently working for Humanity and Inclusion, also known in some Francophone countries with the name of Handicap International, HI, and I will use the acronym HI on the way forward, as that's the acronym that we use the most when speaking about our organization. I'm the Inclusive Development Advocacy Manager for Humanity and Inclusion, and I'm based in Brussels, Belgium. So maybe something about the organization I work for. Humanity and Inclusion is an independent and impartial aid organization working in situations of poverty and exclusion, conflict and disaster. HI works alongside people with disabilities and vulnerable populations, taking action and also bearing witness of doing advocacy in order to respond to their essential needs. The final objective is to improve their living conditions and promote respect for dignity and fundamental rights. Physical and functional rehabilitation has been and continues to be at the heart of the mission of HI, and it actually represents around 25% of the organization's activities across many low and middle income countries. Some key figures from last year says that there were around 250,000 direct beneficiaries to projects that are related to rehabilitation, and 1 million indirect beneficiaries, again, in relation to rehabilitation projects. We have rehabilitation projects in around 40 countries, as I said, in low and middle income countries. Besides, of course, the operational part of our work, there is also an advocacy part, which is well embedded in our social mission. We advocate for accessibility, affordability, equity, and quality of rehabilitation for every person in need. And our advocacy aims at policy change with final impact on people. It is grounded on the operational experience, but is also based on evidence. And that's why when I was invited to join this panel, I was particularly interested in the conversations that we will have today, because this last point, the fact that our advocacy is based on evidence, is particularly important in today's discussion. When we speak about advocacy work, evidence-based advocacy work, it means that we, of course, want to bring in the policy discussions what we observe and witness in our operations, in our programs, but also we want to rely on formal research that can be carried out by the organization itself, but also by other institutions, including universities and research centers like yours. So research for us is not only crucial to improve and advance the way we operate, but it's also necessary to carry out reliable and credible advocacy work. Just to make an example, there is a methodology that was developed by HI over the years, which is called IFAR studies. It stands for Improve Financial Access to Rehabilitation Services. And it's basically an economic analysis of access to physical and functional rehabilitation in low and middle income countries, with the main objective to identify financial barriers to access rehabilitation services, and also to provide information on the average cost of access, comparing these to national levels of catastrophic health expenditure. Why I'm mentioning this analysis, just to give you an example of how this very important analysis allowed us to do better in the way we plan and deliver programs across countries, of course, with partner organizations. But also this kind of research was really pivotal to frame our advocacy arguments, to call for integrating rehabilitation in universal health coverage mechanisms. So I'm very happy to be here today with you and to explore further how research and advocacy should indeed work in synergy and feed each other. Thank you very much.
Thanks so much, Valentina. And David, you're our last.
Thank you. Hi, my name is David Constantine. I'm from the UK. I am a white British male with short, somewhat thinning hair. I'm wearing a white shirt. Behind me is a photograph taken on one of the programs of the organization I worked for a while. A wheelchair using man holding a baby over to his wife as she kneels in front of him in front of a lake. It's a rather nice picture. When I move, you'll see it. I, until December 2021, was one of the co-founders and ran an organization called Motivation. We designed low-cost wheelchairs in low-income countries and worked closely with many organizations like HI, like ICRC, and our main aim was to improve the quality of design in low-income country settings and middle-income country to provide mobility. But we also worked, like the ICRC, through local partners and made sure that we trained national staff in both the clinical and the technical side of providing a wheelchair safely. We also did a lot of work with WHO to help instigate and bring together the World Health Organization guidelines on the provision of manual wheelchairs in less resource settings, along with all the relevant trainings that came along with those. We worked in over 100 countries over 31 years. And I've now stepped down from that role, and I'm currently chair of the International Society of Wheelchair Professionals, a voluntary organization, and I'm president-elect, to follow Claude, of the International Society of Prosthetics, Orthotics. And I also do consultancy with other organizations and design schools. So that's me.
Wonderful. Thank you so much, everybody. The tech really hit me there. It's so wonderful to have such an impressive panel of speakers from across the world joining us today. It's probably why the tech is bound to malfunction a little as we go. I have a new question for you all after providing us with your incredibly impressive credentials. Let's talk about research. And this is a question I provide for you all, recognizing that you are experts in your field, and we have a lot to learn from you, those of us in the audience who may be researchers. Even if you're not directly involved in research efforts, you might well have an opinion on what we should be doing in the fields of disability and rehabilitation. My question is, what should community-based research look like from your perspectives? And that's from start to finish. And then corollary, what are some examples from your own experience of challenges and strategies for success when it comes to gathering, usable data to support disabled populations? And again, anyone can go.
Yeah, okay. So it's quite a wide question, and it's quite it's covering quite a wide topics. But I think research is important, okay, because we all know that in many areas in rehabilitation and in assistive technology, there is still quite a lack of evidence, okay, that either to be used for advocacy, enforcement agents, but also in terms of any to measure the success of any intervention. And I'm talking not about the research necessarily on the technical and clinical part, because this is quite wide and there's quite a lot, okay? I'm not talking about system, okay? And how system can be adapted or can be I would not say what is the best system, but what could be the most appropriate system in different type of contexts. So what do you need to be able to put a system? And the last 3 days I was participating in the pre-launch of the World Rehabilitation Alliance, and one of the work stream is about research, okay, and the need for research to be included as a priority in if we want to have an appropriate rehabilitation services integrated in the health system. And I have seen over my, I'm not directly involved in research. I even thought that sometime I can supervise a researcher, I can provide input, and ISPO is also in contact with different researcher in different field, okay? And of course, when I was working with ICRC, we are not a researcher. ICRC is not a research institution. We are there to support services, but nevertheless, we were conducting research. We were working with researchers, trying to see what was working, what was not working. And I think in terms of and when you do this kind of work, measuring how people see what you're doing, okay, it's quite an important aspect. And to go out of, because you can easily measure impact by looking at the people, by talking with the people that come to the center, but to go to the field, okay, to go directly to the, I don't like to use it, but the end user or the the person at the end of the chain, okay, and to see where he's living and how it's impacting and the community and the family, and I think it's one of the main things. So I always felt that without proper research, it's difficult to support or even to speak with ministry or to speak with other groups and to say, well, you need to do something because of XYZ. You can speak about experience, which is another type of evidence, but it's always better when you have a much more stronger evidence and not coming from your own organization, but that's coming from the community, okay, who are doing the research. Over for me for now. Yeah.
Thank you so much,
Okay.
Claude. Evelyn might be next.
Yes, I can go next. Thanks, Claude, for and I agree with Claude, Jen. This is a whole dissertation question.
I love complex questions. Sorry, everyone.
So for it's okay. I think we'll do our best to answer it. But for us here on the continent, community-based research, CBR, is not a new concept, right? We know that CBR has been recommended by the WHO as a remedy, to the poor coverage of rehabilitation, for example, facilities in developing countries. But let us take a step back into the archive for a moment, as we were already aware, we are already aware that history defines us and it enables us to move forward. CBR was part of our ancestral remedies of supporting their people. During my archival excavation, historical document from 1500 upwards shows that European traders, as they were called during that era, but I bet to differ, never saw any poor persons begging in the street. Now, with this statement, we can deduce that the community took care of its own people. Another fascinating statement from my findings states that during the 1900s, from the Accra Asylum, when the Accra Asylum was that was built and still currently standing today to institutionalize those with mental health issues, were being overcrowded. The colonials resulted back into doing community-based rehabilitation with the support of the communities, particularly the chiefs and community leaders of the individuals being released from the asylum back into their community. One might ask why the overcrowding in the first place during this period. Well, historical documents, both from the archive and books, reveals that during the period of formalized colonization, which is around 1890, an anthropologist known as Rattray provided extensive community account of African spirituality, which has been widely used and referenced today. Rattray was a colonial government anthropologist, as I mentioned, sent to the colonial, to the Gold Coast to document spiritual ontologies, customs, gods, social systems. His accounts opened what is largely, or what researchers largely say that it's a new ground, or perhaps rather an old ground treated in new ways. His documentation we find focused on the behaviors of Africans living in the colonies. I should say that colonialism during Rattray accounts was already in full effect and roughly 30 years into the institution of civilization, with an influx of diverse missionaries entering to save the souls of primitive Africans practicing their spirituality. During this time, though, the Africans were still fully practicing their spirituality, leaving the colonials no choice but to call for the experts, or the expertise, I should say, of Rattray to document and understand from a European perspective this people's spirituality. His writing was deemed important to Gold Coast spirituality history and ways of living due to its wide use and validation of African knowledge of their gods and ways of worship. In this account, Ratri described that African spirituality is similar to madness, right? To be more specific, he provided several examples of episodic madness. I bring this account of Ratri, though, to make us understand that madness was not just looked at from a medical lens, or as if we can, open it up more. Disability was not just looked at from a medical model, but also from both our cultural and social ways of being. So Jen, community-based research, specifically the rehabilitation, as some African scholars have argued, should take we need to address humanistic perspective with the concerns of African-centeredness, empowerment, economic dependency, or independency, I should say, cultural liberation, and vitality. To understand how this is done, as Nkrumah have documented, we need to go to the people's communities. We need professionals or paraprofessionals to live among the people. We need them to learn from them. Professionals must serve them. They must plan with them rather than us bringing and copying and pasting within their community. They must start with what they know. What do you know already when it comes to this, or community development or rehabilitation or understanding disability? And we must build on what they have and what they know and then go from there. So this ground up humanistic approach can work, but only with mass education of eradicating cultural and religious stigmas that are linked to disability. And let's face it, the economic hardships that leads some of our folks to result in throwing or leaving their disabled child, somewhere, or putting them in a dehumanizing situation. Well, I will end there for now and allow the rest of my colleagues to weigh in on the question. Thank you.
Brilliant. Thank you so much, Evelyn. And David or Valentina? David, would you like to go next?
Yeah, sure. I've just been, I'm part of the standards development group for the new wheelchair services standards that are coming out in the WHO. And one of the things that has really shown itself to be missing in terms of research, and like Claude, I'm from a very much a practitioner organization in my past 30 years. So we were unable to afford research. We would support researchers if they wanted to research what we did, but we couldn't ever afford to have researchers come in or pay them or anything like that. So we're very much on the ground, but we created a lot of anecdotal evidence, but certainly no research. But one of the things that's really shown itself in the development of standards is the lack of research data on, and this seems really strange. As Claude said, there's plenty of research on the sort of clinical and technical side of things, but there's a real lack of research on the actual benefits from the user's point of view of whether a wheelchair or any kind of assistive technology provided through a service is beneficial or not. And there's very little research on that to actually really get to the bottom of whether that's right or wrong. And obviously, you'd say, well, clearly that's surely the case, but you can't just assume that. And I've been quite surprised by that. And it's one of the big gaps that the standards are having to lay out very clearly, is that there is a lack of research in this area. So somewhat lack of proof, but it is a recommendation.
Thank you so much. And then Valentina is last but not least.
Yes, I think that the other speakers covered a lot of elements. Maybe what I just want to highlight is that there are actually a few key elements that relate to community-based research that I think are essential in any kind of research, also on disability, on rehabilitation, but that could be valid for really any kind of research on any topic. First of all, I think that it is very important to frame research as a mean or a tool, not the ultimate goal, because the ultimate goal should be improving the lives of people and communities, support them to fulfill their rights. And this is something, the key concept of community-based research that should be applied across our research efforts. Participation is not just a box to tick, so ensuring meaningful participation, of course, requires specific efforts, setting up mechanisms that take into consideration multiple factors, including the format, the design of interactions, and also the capacity to prepare and strengthen this participatory space. I also believe that in this participation aspect of community-based research, there should be a specific aim to leverage the voice of people who are usually left out of public debates or are unheard in decision-making processes. And of course, these groups include persons with disabilities, women, girls, people from rural areas, lower socioeconomic backgrounds, migrants, refugees, indigenous people. In order to do so, to leverage their voices, research should also partner with representative organizations, like organizations of persons with disabilities, women's groups, patients associations, local or grassroots associations where the research is conducted. There was a handbook published by WHO in 2021 on social participation for universal health coverage that actually notes that the major obstacle identified for meaningful community engagement was largely related to social-cultural power imbalances. So I think that researchers should try as much as possible to remove this obstacle of power imbalances and really interact and give the floor to people who are usually underrepresented in research. The other point, it's also about, of course, intersectionality perspective. So to pay particular attention to specific situation of people who experience discrimination due to overlapping factors. In a recent advocacy fact sheet that we produced at the beginning of this year, this fact sheet is called Rehabilitation Through a Gender Lens. We actually highlighted that gender-related barriers affect rehabilitation access, use, and adherence. But other factors, overlapping factors like disability, ethnicity, race, socioeconomic status, can further affect participation or compound bias in referrals and assessment. And another just a key point that I think should come up, no matter what kind of research we are conducting, it's about the need for disaggregated data. Of course, collecting the fact of the importance of collecting disaggregated data is well known, but unfortunately is not systematically applied. Disaggregated data can reveal deprivations and inequalities that might not be fully reflected in aggregated data. And this disaggregation of data, it's important whether you are collecting qualitative or quantitative data. We need this disaggregation both when we use numbers and also when we use stories behind those numbers. Thank you.
Can I just add something, Jen?
Of course.
Because we talk about the importance of doing research and how to do it and all this. But one of the things which is, I think we should not forget is how to translate, okay, the research itself into something, okay, into a way that it can be shared with decision maker, but even with the community, okay. And you can write a nice paper, a nice research, but if you're not able to bring that paper to the people, okay, then it's remained on the table. It's nice, but it's remained on the table, because I have seen some research, and for me, it's always been an issue of taking this and being able to use it, okay, to use it in my discussion with community, with minister, with other groups or whatever, and to make this accessible. Okay. And sometimes they are not accessible. That it cannot just be used as a tool to measure impact or numbers or whatever, but to be able to, as a useful tools or usable tool, if I can say more than useful.
I do not regret asking a broad question, because this was such a rich discussion around how we can structure our work. I'm really grateful to you all for providing such key lessons. What I'm hearing sort of broadly is that we need to figure out how to ground our research. We need to actually be on the literal ground to talk to people in community, to talk to users of the technologies and models that we're trying to develop. And we need to gear our research towards actual outcomes, actual impacts. We need to think about what community needs actually are, so that our research is meant to affect that work. Which leads me to my next question then. I'm wondering about what the key issues on the table are when it comes to disability and rehabilitation work. So my question is, what should academic disability and rehabilitation research prioritize in order to meaningfully meet community needs and expectations?
Okay, I can go.
Go for it.
All right, another.
My students love
Interesting.
my never
question.
tiny questions.
No, you're never, yeah. So anyways, that's easy to understand in theory, but in practicality, we are talking about this from a medical development and charity perspective. For me, the question of what should academic disability and rehabilitation research prioritize? First, we need a scoping review of an environmental scan from across each region that specifically looks at historical perspective of disability from an anti-colonial lens, while also focusing on the states of disability in the regions. Secondly, we need to have specific field curriculum, focused research, such as research from architectural programs or programs in humanities, social services, and health sciences, like let's name it, to understand disability and disablement from an African social justice perspective. Third, we need funding to move this agenda that focuses on research for us, by us. Research funding is being taken on by African researchers who live and work on the continent should be prioritized globally, rather than what we currently see, tourist researchers who are visiting the country or continent for just 2 weeks, and then drawing ambiguous conclusion on issues on the ground, which we can all agree erases a lot of community groups, initiatives that is happening locally, localized research, and it creates problematic and false optics from a top-down approach. The fourth point I will put forward is we cannot do, and my colleagues I've mentioned, Valentina and Claude also mentioned it earlier, we cannot do a disability-focused research or community-focused research and implement policies without having disabled communities on the table. It would not be ethical, and we cannot understand equity without living or having a lived experience as a disabled person. And this is one of the reasons why we've continuously failed to even work within the social model. My fifth and last point is a call for a uniform methodology, as is being researched and argued from several researchers from the continent, that we need a common research framework and methodology in CBR to help the evaluation process. This will not only help table the voices of those living with disabilities in the Global South, but it will allow folks both from within and outside of the continent to understand the experiences from the community level. As it will also bring transparency and accountability within the different regions. And this is where we need to start from, because accountability for us is where the issue is stemming from. We have amazing policies on disability, inclusion, and inclusive education, rehabilitation, let's name it, but we fail when it comes to accountability. So I'll end there and listen to the rest of my colleagues.
Thanks so much, Evelyn. Who would like to go next?
Yes, if I can
Claude.
build on what Evelyn was saying. I think it, for me, if you ask me what is the priority, I will probably answer as the first answer, system, okay? System to make sure that what we intend to do, or what are the policy I intend to do are really, I would say, reaching the last person at the end of the line. But to be able to do that, and I think before, and I think Evelyn has said, I think we need to be in contact with the community. So I think probably one of the first thing I will do is to speak with them, okay, and try to understand from their point of view what are the situation, and then to try to build something that will provide to or overcome most of the barrier they may have. Because I could be sitting in my office in France or in Brussels or wherever, and I say, well, yeah, okay, okay, but if I don't speak to the people I'm intend to do a research for or to help, then it's a bit difficult. And I agree with Evelyn. I think it's not only somebody that could come from all over the world to come to Ghana for 2 weeks or 3 weeks, because it's not possible to understand the context and the cultural factor that may interfere here. But it can be a mixed team, because it's also, I think it could also help building a community that can see things differently and more widely, okay? But first of all, the first priority will be for me, though, let's have a chai in the village and discuss with the people, okay? And try to understand their challenge. And not only people with disability, because yes, people with disability are a group, but there are also other groups, okay? And now you could see now with the increasing aging population now, and how to deal with this population, yes, and how, yeah, I think there's many issues with the changing in the population profile, or in all over the world in different countries, different pathway, but there is a change in terms of context, and for this, yeah, and I will probably take the time to have depending in which country I am, but sometimes a coffee if I'm in Ethiopia, because the coffee is good, but in other country I may have a tea or orange juice or mango juice, depending on the season. But let's take the time to discuss with the community first.
Lovely. Thank you so much,
I think
Claude.
Claude is right in that.
David's next.
Sorry, Jen. Sorry.
Go for it,
I
David.
think Claude is right in that. It isn't just the population you think you're focusing on. Say, for example, the population of people with disabilities or disabled people It's the people around them, it's the community around them that especially in terms of assistive technology, if that isn't right, then it affects the people around the people with disabilities themselves, along with the aging population, as Claude said. And I think that's absolutely right what he's suggested. So it's a very broad community.
Just lovely. Thank you so much. And Valentina, you might tie us off for this question.
Yes, no, I think that all the others already made the point about, again, the priority to foster community engagement. And I really think that one thing to be prioritized in research, it's the understanding of people experiences as service users. Services, of course, could be health, education, also rehabilitation services across the 4 key dimensions of services delivery: availability, accessibility, acceptability, and quality of services. I think we still lack understanding of services users' experiences. If I take a step back and put my global advocate hat on, I think that for rehabilitation, we would benefit definitely for further research and data collection on access, experiences, outcomes in rehabilitation and assistive technology, going a bit beyond the anecdotal approach that is today very widespread. Also, currently available research mostly comes from high-income countries, and we definitely need more research on rehabilitation and assistive technology from low and middle-income countries, and I would say in particular in fragile and conflict-affected settings. And another thing that would definitely make our advocacy arguments much more convincing would be to have more solid data around the return on investment, because this is critical to catalyze resources for any sector, including for rehabilitation. There was in 2020 a report called The Case for Investing in Assistive Technology. This was published by AT-Scale. And this report describes the enormous gains that access to assistive technology can have for the community, for the economy. I think the return in investment is 9 to 1, so very high. I look forward to have a similar estimation for rehabilitation services too, because I feel that when speaking to decision makers about the importance on investing in rehabilitation, we need to make sure that they understand that it's a sound investment, and research on this is still too limited to really make the case for that.
Thank you so much, everybody. I'm hearing that partnerships and direct engagement are essential to this field of research, and I love this actually essential step to the process of having drinks in the spaces you want to study in order to take time to build rapport, to build trust, and to understand the community that you want to work with and in, because disabled people tend to look to community in order to have the supports to live. And I really take as an important lesson in this particular panel that a lot of the research that is generated in this field is overly focused on high income countries that have wealth and predominantly white disabled populations and more infrastructure than plenty of disability populations around the world can enjoy. So our research needs to focus on where there is need. If we're ready for a very last question for you all, and I think Claude might have touched on it beautifully in a previous question, so there's opportunity to develop upon it. how can disability and rehabilitation research communicate findings to key stakeholders? And how can we do so in ways that advance public policy and produce meaningful transformation? So I'm thinking about outcomes and dissemination now. How do we do that in ways that are community grounded?
Again, again, an interesting question with not an easy answer, huh? Because if I had the answer already, I would not have raised that point, the question before. Okay, but it is complicated because many research are done, let's say, to measure, or starting from one of the WHO guidelines or how you should do X, Y, Z, and okay, which are not necessarily, with nothing against WHO. I don't want to make enemy at WHO, but sometimes it could, maybe it could be look on the other side and see how the research was done at community level can impact or can improve or modify or adapt the WHO guidelines. And I have tons of examples of things that I'm not completely sure it works in different contexts, but the translation, the passing of the information is one of the key elements. And if you pass the information to the minister or to the head of an organization or whoever, you will not present it the same way you will present it if you want to talk with the an association of elderly association or person with disability association. So you need to adapt the way you present it, and it needs to be, well, I will say it's nice to say, well, this is what happened, but what could be the recommendation afterward? In which direction it should go from the funding of the research? And then, and I think if I talk with the Minister of Health of Togo, I would not present the result of any survey if I talk with the Togolese Federation of People with Disability, but the aim will be the same. Okay, the aim or my objective will be the same, is to get them more support. Okay, from the ministry, maybe to prioritize some element, and for the Togolese Federation of People with Disability to take some message, to make advocacy and to push the society to do something, or the community or the professional or whoever. Okay, that's it. Over.
I was going to add to that. Claude's absolutely right. I think, when you're presenting something to, say, the Minister of Health of Togo or any other country, those with lived experience coming into an office have a great deal of impact. But obviously, the local societies and movements of those with lived experience don't often get an audience for those kind of people. And so facilitating or helping them get to that through links with Rachel or whoever presenting the research can have a very personal impact on an individual who's in charge at the time and make a real difference. The number of stories you hear, I met this particular person one day and they presented me with this, and it changed my thoughts on this whole approach. And so I think, using those lived experience, but backed up by the data and the research, is very important.
If I can jump in, I think that Claude really touched on a very important thing. He mentioned advocacy, which of course is my field, and my simple or my immediate answer to your question, Jen, would be work with advocates and advocacy experts if you want to communicate findings. But indeed, I think that we need to strengthen a sort of triangular cooperation. Researchers, policymakers, practitioners, and make sure that that advocacy is there to enable the possibility of conveying messages that come from evidence and from research findings. The academic language, we know, is very often not adapted to the stakeholders who we want to speak with. or who can make a change in terms of public policies. So, of course, as David said, we need to customize the messages. And when we speak about tailoring or customizing messages, we need to think of the substance of the message, but also the language, the tone, and the focus that we want to place emphasis on. Again, as it was said also by someone else, we need also to present a solution. We know that when we're speaking, for example, with a decision maker, it will not be just about communicating the finding, but it will also be about suggesting what could be the solution, have a call to action with recommendations or guidance on how to act. And this, of course, requires a step further, starting from the research and then bringing the reflections one step further to really see what could be done, what should be done to improve the lives of people. Of course, there are many ways to deliver an advocacy message. It could be written, face-to-face, digital communication. The choice of the way or the channel for delivering the message, it's also very important. I would say equally as the messenger, which is sometimes even more important than the message itself, as people tend to remember more whom they met and spoke with than the details of the message that this person brought to their attention. I think it's also very important to carefully select your messenger. As David was mentioning, someone who has a lived experience could have a very important impact on the audience. And sometimes we have the temptation to opt for a messenger who has a very high level of expertise on the topic, but maybe in other occasions we need rather storytellers that could have a different impact on the stakeholders we want to convince, we want to speak with.
I agree with, and I'm sure you all see me just nodding and say, yes, yes, that's exactly what it is. But, you know, to add to this conversation already, we need to have community stakeholders as co-researchers, right? Co-researchers, co-PIs, leading the conversation. I will give you an example. Currently, I applied, or we, myself and a group applied to an IDRC grant to look at forced motherhood of children from 10 years of age, mothering around the Bono region, Sunyani. The team and I had to go pay an official visit to the Queen Mothers Association. And they had to report every information discussed with them to the chiefs. We had to approach community developers and mobilizers who in their communities are also key stakeholders to give us permission and be co-PIs before we could start the process of applying for the grant. This process was quite daunting for me as you know, a new faculty member in Ghana, and quite expensive as well. But I argue that it should be normalized to have community leaders as co-PIs, because marginalized groups are over-researched without payment. That's free labor. And results, no results. They don't see results. They just know that you're coming to research them, and that is the end. I mean, yes, I have the academic language and platform to describe issues to the global stage, as we're doing right now, but they have the historical background of their communities and the lived experiences, as my colleagues have all mentioned. So in actuality, I shouldn't be able to do my work without co-authoring or co-researching without them And they also might not have access to distribute their knowledge to the larger world. So it means that we can create a relationship that is braided in community social justice. This way, they can help advance public policies that will produce meaningful transformation for their communities, rather than research suggesting or governments creating policy approaches from the West and from a top-down perspective that does not have their local communities in mind. We continue to see this cycle. We need to be explicit in making sure that we are not researching vulnerable community to only advance our research and careers. Rather, we should be researching with the mindset of moving the needle, making sure that monitoring, evaluation, accountability is being recorded, documented, and meaningful changes are actually happening within these communities. Again, going back to my earlier conversation, this is a bottom-up approach that respects the wealth of knowledge from the community. It's a partnership, and it should, as I mentioned already, be braided in the social justice relationship that binds both the researchers and the community together. I can't just come in, research the community, and I'm out, right? And not pay for their labor, not understand what they're going through, not eat with them, as Claude said. Let's have coffee, let's have tea, let's have palm wine, as we have in some of our communities. Let's localize what it means to do research. Let's normalize it. Thank you.
Oh, what a day. Speakers are welcome to interrupt me if they have any concluding thoughts as we wrap up. I did want to note, I've learned so much so far, and just some final reflections on the talk in general and this question. If we want to do research that is focused on disability rights, it's going to be complex, it's going to be culturally specific, and it's going to come with intersectional considerations. And there are ways we need to do research that keeps us accountable, to borrow from Evelyn's previous statement, to the communities that we work with, because they're not just people we study. We can't just do extractive work. Thinking about impacts is one key way of keeping us accountable in our research. And then, as I've seen in this excellent exchange in this last question, working with community partners, especially advocates, and then involving community stakeholders who get credit and remuneration on our projects is a really important way to keep us accountable, because we need to think about who's conveying our messages when we have research to disseminate, and then who's shaping that message, because we've talked about how the message needs to be shaped for our stakeholders.
Can I just add something?
Please do so, Claude.
I think there's something, but I think the disability community used for many years the motto, "Nothing for us without us," and I think that should be applied in any research, okay? Because I think the community are not subject, and they are people there, okay? And I think having a tea or palm wine or whatever it could be with them, and as Evelyn said, also to include them in the process so they understand also what are we doing, and then they can bring a lot of input. And I'm not sure it's complex. It just takes time. I would not use the same complex. I would use time consuming. Oh, wow.
That makes a lot of sense. It can be as simple as wine. It just takes time to build that rapport sometimes. Wonderful. Claude, that was a beautiful final statement. I don't know if anyone else has some final reflecting thoughts. Otherwise, we can pivot to potential questions in the audience. Good?
We are good. And I would send out an invitation, whoever wants to come to our community to have palm wine. We are open for business.
I I'm so excited about doing research with everyone who wants to drink with me. I'll note I've learned a lot as someone who identifies as a disabled researcher, but like in a lot of ways I carry so much privilege. So I need to really think about how to do the research in ways that involves community stakeholders who experience disablement in a lot of ways that come with significantly more disadvantage. Because yeah, the lines between researcher and research don't have to be so rigid, especially when we start thinking about how to break bread with the people we want to work with. It's a lovely approach to research that I think is also incredibly essential, is what I'm hearing today.
And I think, Jen, if I can add to your point, understanding that we all come, or most of us on this today are privileged to have access to this conversation. And, it's how we use our privilege as well. How do you use your privileges to do the work that you want to do, the advocacy work, the groundwork? How do you use those privileges to make sure that the work is done done in a social justice way that supports from the ground up?
Wonderful. And that means Evelyn had a beautiful concluding thought as well. The floor is for David and Valentina if they have any thoughts that sparked. Otherwise, I'm happy to pivot. We're ready. Wonderful. The audience might have questions, and we have about 8 minutes remaining. You are welcome to pose a question in the chat window. You are also welcome to use the raise hand feature, which is a button under the reaction. There's a reaction button at the bottom of your screen. So I'll give you that usual awkward minute or so to think about your question. We sit silently and feel free to chime in. If you want to raise your hand, you're welcome to turn on your microphone, even your camera, so that we can communicate directly. Pierre.
Hi. Oh, sorry.
I saw Pierre Cote's hand up first. Do you want to wait?
We can start with the other person, yes.
Let's find the other person. Who just said sorry? I have a long
this is
list.
Caitlin.
Caitlin, you are welcome to ask a question, Caitlin.
I believe it was Valentina. You had mentioned piece of research, social participation. Something was published in 2021. I didn't catch the full name, but I'd love to do more research on that. So if you wouldn't mind giving me the title of the research, that'd be great.
Sure, I can post it on the chat so that everyone has access to this resource and other few resources that I mentioned.
Thank you very much.
Wonderful. Maybe I'll turn to the chat before I pivot to Pierre Cote, our intrepid institute director. But Chandima has asked, is there any scholarship program to study rights of disabled people? I'm thinking about graduate programs in my own neck of the woods. I know that there is a human rights component to the critical disability studies graduate programs, both master's and PhD at York University.
But unfortunately, because it's also a very, how should I put it, recent, program as well. It's difficult for students to acquire scholarship. So if you're looking at just focusing on scholarship itself to be able to take the program, it's something that maybe having or seeking for scholarship outside of the program to be able to come into the program would be an excellent source. On the top of my head, I do not know of any scholarship that supports that, but the only program, as Jan's mentioned, that does or that looks at human rights and disability from the same space and the intersectionality of disability itself, it would be York University, and it's the only graduate program in Canada as we speak, thanks to Marcia Rio.
Right, and Evelyn's point is a good one that I'll put on, maybe I'll note on recording that it's a good caveat to mention that we're not that good to our international students in the post-secondary context. They are significantly overcharged for tuition rates. So I just issue that warning if you're looking for a graduate program abroad and look to the Canadian context.
Hence why we are trying to have it hopefully at University of Ghana, and a partnership and could be also developed with York University, with UIT, your university, Jen, and then see how students can do more of this cultural exchange, also to understand disability from human rights from all different continents, right? So let's see how it goes after our conversations.
That sounds exciting. Stay tuned. There might be more graduate curriculum development along the way, maybe in partnership with our institute that does do a lot of work to support graduate students studying health and might have a disability focus. So we might have more explicit disability-based research-driven graduate programs in the future. That sounds fun. Pierre might be next. Do you want to ask your question, Pierre?
Thank you. Thank you very much, Jen. And thank you, Valentina, Evelyn, Claude, and David for a great discussion. A quick comment that you may want to respond to. I think we also need to advocate for the inclusion of people with disability within graduate programs in universities and increase the professoral core of academics with disabilities who actually teach in our universities globally. As a professor, I can say that we have done a very, very poor job at including people with disabilities within academia. And I think that this would greatly complement all the great suggestions that you have done. So a call to actions to all of us to advocate to our universities, policymakers, and governments for the inclusions of people with disabilities in graduate programs and as professors. Thank you very much.
Oh, I love a call to action. For those of you who don't know, Pierre Cote heads up our institute. So his work around advocating for disabled populations is renowned. And I'll take that to heart myself in terms of advocating on behalf of faculty and students who belong in this space, who absolutely belong in this space. And we need to think about how to accommodate them so that we can advance disability research alongside and spearheaded by disabled people. And then Joseph might be potentially our last question in the 2 minutes remaining. Joseph, would you like to ask your question?
Thank you for the opportunity. I'm Joseph Cromwell. I'm a PhD student from the University of Ghana. And I'm a person with a disability, pursuing a disability program in biblical studies. And I want to take this opportunity to thank our speakers for the good job done. But then I want to also tell Dr. Evelyn that I will contact her, and then we continue the discussion from here. And like the last speaker said, there is the need to encourage persons with disabilities to actually go into disability studies so that the lived experiences will become part and parcel of the research. Otherwise, the research is done without that aspect which is, I call it, yes, it's a lively aspect. It's a living thing, a living organism that needs to be actually push the research. The research should not be done in a vacuum, but
Yes.
then the lived experiences should be incorporated. That dialogue should be there. And I think that in this instance, we need, as a community, to support persons with disabilities to actually pursue this, so that together we make the whole world a good place for all of us. And as we go ahead and along in organizing these programs, my main thing is that let us do our best to also support in terms of funding. And yes, because disability studies, or in pursuing education at the highest level as far as disability is concerned, it's not an easy thing for persons with disabilities. It comes with, I would say, a huge cost. And if that support is not there, it becomes difficult for such persons. I thank you for this opportunity. And as we go along, I believe these conversations would actually make a great impact in our communities. Thank you.
Thank you so much, Joseph. What a lovely way to close us off. I do see there are some questions that we won't be able to answer today. I'm thrilled that the Q&A portion is lively. With my apologies, we ran out of time. This is a good lesson for me to tighten my introductory remarks. And if the speakers don't mind, you are all welcome to send me questions, and I would be happy to forward them along if anyone has any thoughts on how to answer them. So any lingering questions, you're welcome to send to the email address in the chat window. And just one more time, our next talk will be October 5th. This time it'll be 6 to 7:30 p.m. Eastern time, Toronto-based time. And is called Imagining Accessible Worlds. I'm so grateful to the speakers today for such a really grounded and deeply knowledgeable conversation. I feel like you're going to direct Institute research in ways that, and I hope beyond the Institute, the researchers on this call, research in general on disability and rehabilitation in ways that are more accountable, less extractive, more grounded, more readily able to engage with key stakeholders and partners. So thank you everybody for coming, and I hope to see you all next month.
Thank you, Jen. Bye, everyone.
Thank
Good
you very
work.
much.
Thank you, speakers. Thank you for interpreters as well. And our captioner. And anyone who's still here, I'm just figuring out tech. So I'm not closing the event very quickly. My apologies for that. Jenna's going to stop recording.